Hi, my name is Kei Suzuki, and I'm a thoracic surgeon at BUSM Medical Center. My colleague, Dr. Katrina Steiling, a pulmonologist who runs the lung cancer screening program at BUSM Medical Center, and I would like to talk about healthcare disparity in lung cancer screening. One of the important initial goals is to raise awareness, and in doing so, we hope it will lead to more research and more collaborative efforts across different disciplines, cancers, and institutions.
The disparities that we see in lung cancer screening and similar to other cancer screenings and other diseases in general, I think are multifactorial. One of those reasons is that patients might not know about the test. Things like breast cancer screening and prostate cancer screening, you often see advertisements for it, they're in the news a lot, but lung cancer screening is relatively new, and I think it's something where the word is just getting out to communities and many patients aren't yet aware of the test. Similarly, I think some providers aren't yet aware of the test or aren't aware of the strong data supporting using low-dose CAT scans to screen for lung cancer. Other barriers include things like taking time off of work, potentially being underinsured and not having the money to pay for their appointment because they're concerned about other things like housing insecurity or food insecurity. Even when we identify somebody as being eligible for a lung cancer screening CT scan, sometimes it's still hard to get them to come in for the test. That can be because of the shared decision-making visit that's required prior to obtaining lung cancer screening. It's a separate office visit. It requires the use of a decision aid. These are printed materials with mathematics on them, graphs on them, and it can be challenging for some of our patients with limited English proficiency or literacy to understand those materials. Another limitation once patients are identified as potentially being eligible can sometimes be the myriad of other medical problems that need to be addressed prior to talking about things like a screening exam in a relatively healthy patient.
When it comes to the issues we face in lung cancer screening, I believe the downstream effects are twofold. Number one, safety net patients are at higher risk of harboring lung cancer. And that is because some of the known risk factors of lung cancer, other than smoking, so factors such as black race, pulmonary comorbidities like COPD, and family history of lung cancer are more prevalent in our patients, which means we need more emphasis on improving the screening efforts in this population. The second downstream effect is not only could they be at higher risk of lung cancer, they're also less likely to be screened. To start to identify the exact issues, one of the first things we did was to review our own efforts. So we reviewed the initial 2-year period of screening to determine roughly what is our screening rate. We estimate that to be about 16%. The screening rates for other commonly screened cancers, for example, is much higher. About 70% for mammography, 80% for pap smears, and 50 to 60% for colonoscopies. So this goes to show that we have a lot of room for improvement for lung cancer screening. Next, Dr. Steiling will talk about what we are doing to potentially mitigate this disparity.
It seems like implementing lung cancer screening should be straightforward, but the reality is that there's many moving parts. And so you need to get the word out to the patients that they are potentially eligible. We made a point to engage our primary care providers, both located at Boston Medical Center and in our community health centers, to make sure that we were structuring the program in a way that worked for them. We involved hospital administration to make sure that we had the money to launch the program and the resources to be able to hire the patient navigator and nurse coordinator to help manage those scan results. We've gone out to educate patients and to educate community primary care providers about the availability of lung cancer screening and about the eligibility criteria. And we include information in multiple languages for our patients. I have seen firsthand what an effective screening test this is, and I have seen so many lives saved by it. And I really want to find a way that we can reach more people so that they can have a similar experience and live longer because we're finding their cancers and curing them.